Hello everyone, my name is Stefano and I'm Emergency Country Director for Afghanistan mission. And first of all, I would like to thank you all for being here with us and for coming to this event organized by ISHKAR in order to support our activities in this country. I will now try to give you an overall update in a nutshell of the latest in Afghanistan. And I would like to start by mentioning how the end of the war and the simultaneous takeover of the Taliban inaugurated a new chapter of the history of this country. So in 2 years' time, what we definitely noted at field level is an improvement of the security conditions, which unfortunately did not match with an improvement of the economic and humanitarian situation in this country. And the factors are several, and just to mention some of them, we have a high level of inflation, we have a high level of malnutrition and widespread hunger in the country. Just to give you some numbers, 6 million of Afghans are at the risk of famine. And then we have a drastic and general increment of the poverty in both urban and rural area. And these are all factors which are leading the 97% of the population to be considered below the poverty line. And up to date, more than 29 million of Afghans are in need of humanitarian and aid assistance. It is important to mention how Afghanistan has one of the highest level of contamination from explosive in the war. Mines, improvised explosive devices, and remnants of war are still disseminated throughout the country. And of course, as always, who is paying the highest price of it are the civilians. And we are still recording a worrying numbers of patients coming to our hospital in need of health assistance. Coming to the health sector, it is estimated that in 2023, 7.6 million of Afghans will be cut out from the life-saving and essential healthcare treatment. This is due to the fact that nowadays to be treated in this country is very expensive, and this coupled with the economic crisis ongoing does not allow the healthcare system to be accessible. In general, then, the health facilities are inadequate. There is a lack of doctors and nurses. There is a lack of medical equipment. And in general, especially in the rural areas, it's not even possible to have the provision of essential services such as water and electricity. The health sector, among others, also suffered from the reduction and in some cases the suspension of the humanitarian funds availability. And this is important to mention because in the past the humanitarian funds were covering the 75% of the public expenditure of this country. So the impact of this reduction is huge and is cross-cutting to all the sectors of intervention. So we don't have many elements to say that the situation will improve. We are actually quite worried, and we rather think that there is the risk to forget even more what the General Secretary of the United Nations defined as the world worst humanitarian crisis. Since August 2021, Emergency has admitted more than 41,000 patients in its hospitals, and we provided more than 720,000 consultations in our network composed by 42 first aid trauma posts and basic healthcare centers. Our aim is the one to tackle the new health needs, and in order to do that, we revised our admission criteria, marking this switch from the war surgery, which represented the majority of the patients received during the conflict, to the civil traumatology. Nevertheless, we continue to admit as well patients with bullet and knife injuries, which is strictly related to the increment of the criminality, which is related to the economic insecurity in the country, as well as patients with mine and shell injuries. And this is an indicator on how, even though the conflict is formally over, still the legacy of it is present in the country. And our activities are also continuing in the Panjshir Hospital. We keep providing consultation to pediatric consultations in Panjshir, and our maternity is registering an average between 500 to 600 delivery per month. Amid the changing political landscape, the freeze of the international banking system, the escalating economic and humanitarian crisis, and the continuous restriction on women, emergency keep its presence in this country, and we keep providing our free of charge and high quality healthcare system to the population. In a landscape where the reduction of the institutional funds for 2024 is quite confirmed, fundraising activities are even more important to keep running the totality of our activities. And the impact of this is real. Let's just consider that the average cost for the admission of one patient in our hospital is around $100, and that in line with the strategy to have a long-term sustainability of our activities, the 97% of our emergency staff in Afghanistan is Afghan. This means that emergency is supporting more than 1,700 households in one of the worst economic crises in the last decades. So, on behalf of all emergency staff, I would like to thank you all for your contribution, and the possibility to be here and to do our job is also something that we are able to do thanks to you. Thank you very much.